Hello student, very good evening to all of you. I hope I am clearly audible and visible at your end. So just give me a thumbs up before we start the session. So in the chat box just give me a thumbs up whether I am clearly audible and visible at your end or not, and then we are going to start the session. So as you know, these are the recall session for the last INI-CET examination, and I hope all of you have did a great session. The questions in physiology that we are going to discuss in this session. So before going into the actual discussion, just let me know whether I am clearly visible and audible at your end or not, right? So then we are going to start the session. Anybody? Clear? Okay. Just give me a response. Give me a thumbs up whether I am audible, visible to you or not. I hope so. Okay. So the questions will be discussed based on the recall from the students. So at any point, if you feel that the questions are not proper, the stem of the question need to be changes or some options needed to be changes, please let me know in the chat box so that I can update the questions, right? So we are directly going into the questions and we will be discussing only the answers. Detailed explanation we are not going to give you, because I know because exam has been done, you want to know the answer, correct answer of the question. So we are going to give you the correct answer only. So first questions that is coming here from the general physiology topic. Which of the following type of transport does not require adenosine triphosphate? So I believe this is an easy question and all of you have done great, and correct answer will be, so paracellular transport, it's an correct, means no ATP is not required for this. Simple diffusion, so this is also a kind of passive transport, ATP is not required. Facilitated diffusion, this is also a kind of passive transport, so ATP is not required. Sodium potassium ATPase pump, so this is a kind of active transport, primary active transport, so ATP is required, so this is not my answer. And symport antiport, this is also an secondary active transport, so ATP is also required. So this D and E is not going to be answer because it require ATP. Your question is does not require ATP. So your answer will be A, B and C, they are the correct, A, B and C. These are the three transport which does not require adenosine triphosphate. Paracellular transport, I hope all of you know, the transport between two cells through the tight junctions we have explained in our classes. So A, B, C is the correct answer. So here your answer will be A. A, B, C is the correct answer. I believe this is all good from all of you. All of you have done great in this question. I think correct answer all of you have given. Okay. So this is a simple question, option A, right. So next question was an image based question. Some of the students are saying that this ABC which is given in this images, say ABC was not there. But anyway, if the question is defective, question is fault, so you will get full marks. But suppose the ABCD options was given here like this. So as we have explained in our classes also, that this light color band that you are finding it here, that is the I band. So basically C is the I band. Okay. If I have to start, I will start from here. So C is the I band. So C is I band, right? Okay. C equal to 1. C 1 के साथ जाएगा. Then at the middle of this A band, this D, this is nothing but the Z line, right? So this D is Z line, means D is with 4. Okay. And then you are getting this whole dark color band, and all of you know dark color band means this is nothing but the A band. So this B is nothing but the A band. Okay. So B is A band. So B is with 3. B is with 3, and obviously A is going to be with 2. So that is H zone, or at the center of the H zone there will be M line. So I believe this is the H zone. So A with H zone, that is A with 2, right? Okay. So A2, B3, okay, C1, D4. So this A is going to be your correct answer in this question. I think this is also an easy question and all of you have answered correctly. So basic thing is that you have to identify where is your light color band and where is your dark color band. So this whole light color band is the I band, and at the center of the I band we all know Z line is there, and this whole dark color band is the A band. At the center of the A band there is a zone, that is H zone, and at the center of the H zone M line is there, right. So, that way option A is your correct answer in this question. Okay. Now, next question we will go. So, now this is a question which I have discussed in my main video lecture. In RR video lecture it is not there. Rest previous two question that is already there in the RR video as well as main video, but this question, what factor contribute to the latent period of a single muscle twitch. Okay, single muscle twitch or simple muscle twitch, basically proper word will be simple muscle twitch. So, if you look at my main video lecture, so I have explained there that after giving a stimulation you will get the contraction and relaxation of the muscle, but before that there is a gap between the stimulus point and the onset of contraction point. So, this gap is known as the LP, latent period. So, here the latent period generally 10 millisecond. Now, they are asking what is the cause of this latent period. So, if I go back here once again, so the time interval from the point of stimulus to the onset of contraction, this is the definition of the latent period. So, this is obviously a true statement, right. Now, second thing is that latent period, why there will be latent period. So, suppose this is the neuron, okay, and it is connected with the muscles. So, this is the muscles, okay. Now, you are giving stimulation on the surface of this neuron. So, whenever you give stimulation to the surface of this neuron, first the action potential will travel through this neuron, okay, then it will cross this neuromuscular junction, okay, and then the excitation contraction process will happen, because of which the calcium release will occur, and because of the release of calcium the muscle contraction is going to happen. That is the whole thing, getting my point. So, if you give a stimulus on the neuron, there are certain sequence of event that has to happen. What is that sequences? Neuron, first the action potential will travel through the neuron, then it will has to cross the neuromuscular junction, then it has to release the calcium from the sarcoplasmic reticulum, and this release of calcium is done by the excitation contraction coupling, and whenever the calcium is there, the contraction is going to happen. So, if you look at the question, excitation contraction coupling is also required, because that is going to release your calcium, and the neuromuscular junction transmission is also required, otherwise excitation contraction not going to happen. So, this 1, 2, 3 is required for this latent period, because 2 is the definition of latent period and 1 is 3 is required. But the fourth, if you look at transfer back of calcium into sarcoplasmic reticulum, this is required for the relaxation of the muscle. This is not for the onset of contraction. So, this number 4 option, this is not part of the latent period. So, 1, 2 and 3 will be the answer. So, A is the correct answer in this session. Dr. Arshad has given the option A correct answer in all of the questions. Other you can also put your answer, and if you think that some of the options are not correct, you can also tell me that. So far so good, I hope all of you. Okay, there is no confusion here. Okay, so next question we are going here. So next question, which of the following helps to decrease the GFR? Again, this is a simple question, just you have to think a little bit. So, if you have read my RR video lecture also, then we have discussed that this hydrostatic pressure of the glomerular capillary and oncotic pressure of the glomerular capillary, and the Bowman's capsule hydrostatic pressure and the Bowman's capsule oncotic pressure, which forces is helpful for the GFR and which forces is not helpful for the GFR, or opposing force for the GFR. So, as you know that decreasing the oncotic pressure of the glomerulus. So, glomerular capillary oncotic pressure, if it is reduced, then what is going to happen? The GFR is going to be increased, right. So, this is not my answer. Increasing the hydrostatic pressure of the glomerulus, same thing is going to happen, the GFR is going to be increased. So, this is also not my answer. Okay. Increasing the hydrostatic pressure of the Bowman's capsule, this is definitely going to reduce your GFR. So, this is a correct statement. Now, the first option, if anybody could recall, decreasing filtration constant or filtration coefficient, what was the actual? Filtration constant or filtration coefficient, what was the actual option? If you could recall, please help me. So, if you look at the GFR equation, GFR is equal to Kf, that is the filtration coefficient, multiplied by the force that we are going to discuss here. So, this Kf, as you can find out in this equation, if the Kf is decreasing, then also GFR can reduce. So, that is why I am asking you, please try to recall what was the actual option. This was decreasing filtration coefficient or increasing filtration coefficient, otherwise this is also a correct statement. But even if suppose the A and D exactly the same option was given in the choices, then also the better answer will be increasing hydrostatic pressure of the Bowman's capsule, right. So, okay, yes, coefficient will be the actual wording, right. So, coefficient, not the constant, it is a coefficient. Okay. So, decreasing coefficient was there or increasing coefficient was there, and here also look at increasing hydrostatic pressure of the Bowman's capsule was there or decreasing hydrostatic. So, these two words will determine your correct answer, but what I am saying, even if the options were exactly the same, both A and D are correct, but here I will go more for the D greater than A. So, D is the most correct answer. One भी ठीक है, yes, 1 is also correct answer. If you decrease the filtration coefficient, the GFR is also going to be reduced, and if you increase the Bowman's capsule hydrostatic pressure, then definitely the GFR is going to be reduced. So, both A and D will be correct, but even if you have to choose only one option correct, then D is a better to choose here, because filtration coefficient has less effect. Increasing filtration coefficient, yeah, then increasing filtration coefficient होगा, then this is not your answer. Okay. So, great, thank you so much, Dr. Mishra and Dr. Arshad Ali, thank you. Okay. So, this is, I believe the D is the correct option, there is no other choices to choose from in this question. Okay. Now, we are moving on to the next question. So, this is the RR video slide. Okay. Okay, great. So, static 2-point discrimination. So, this is one of the controversial question. I told you multiple times repeatedly that 2-point discrimination, the main receptor is Merkel's, and for the Braille also the main receptor is Merkel's. Okay. So, if you look at the neurophysiology textbook, the 2-point discrimination is based on the property of the receptive field. If you look at the receptive field, Merkel's are the smallest receptive field. Meissner's is also there, Meissner's can also help, but whenever you are moving your finger on some surface, in that cases Meissner's are more helpful. So, that is why I told you even in my RR lecture also, these two important, that 2-point discrimination is by Merkel's also, as well as Braille reading is also mainly by Merkel's, although Meissner's is also there for the Braille reading, because whenever you want to detect some point, okay, sharp point or edges or corner, the best receptor for this is Merkel's and Merkel's. Getting my point? So, if you want to feel the finger tip of this pen, right? So, the best receptor point, corner, edges, for all of them the best receptor is Merkel's, and Merkel's are the smallest receptive field. Okay, although the receptor density is very high for Meissner's, so the single best choice that has to choose here is the Merkel's. Okay. So, I told you repeatedly that this is clearly given in the neurophysiology textbook, that if you have to fill some dot or point or elevated area, then it is the Merkel's. So, 2-point discrimination, the test which is done in the neurology is the Merkel's is the answer, and Braille is also Merkel's. Okay. So, this is the Merkel's. Now, which of the following statement about physiological dead space is correct? Could you tell me the answer of this question? So, you know the anatomical dead space, that is the volume of the conducting zone of the airface, and you also know the alveolar dead space, that is nothing but dead alveoli. Dead alveoli means the air is there inside the alveoli, but that air is not taking part into gas exchange. In respiratory system, dead air means the air which is there inside the alveoli, but it is not able to exchange in the blood, not taking part in gas exchange, that is the dead air. So, normally we know that the physiological dead space is equal to the anatomical dead space plus your alveolar dead space, right. So, obviously, in normal cases this alveolar dead space is 0. So, in a normal person, because the alveolar dead space is 0, in that cases physiological dead space will be equal to the anatomical dead space. Physiological dead space is equal to the anatomical dead space. And how this physiological dead space is calculated? Physiological dead space is calculated by a mathematical equation which is known as the Bohr's equation. Okay. And this anatomical dead space, how this anatomical dead space is calculated? Not by spirometer, but a method which is known as the single breath nitrogen washout method. So, this is done calculated by nitrogen washout method. Now, with this concept, we have discussed this in RR also, in main video also. So, less than anatomical dead space, physiological dead space is less than anatomical dead space. It is only true if there is certain pathology, like for example emphysema or embolism, in that cases it is less than anatomical dead space, otherwise this is equal to. So, this is not the correct answer. Can be measured by spirometry, so this is also not possible. Now, inadequate ventilated alveoli. If the alveoli is not ventilated, then the air is not entering in that alveoli. So, that air is not the dead air, because air is not entering. What I told you, what is about dead bed? Dead bed means the air is entering in the alveoli, but that air is not able to take part in gas section. So, suppose this the capillary which is supplying the alveoli, and there is an embolism in this capillary. So, what will happen? Although the air is entering inside the alveoli, but that air will not be able to take part in exchange. So, in that cases, this air inside the alveoli will be equal to the alveolar dead air, and that will leads to the physiological dead air also, because physiological dead air is equal to the anatomical plus alveoli. So, inadequate perfused alveoli means if there is an embolism, then and then only this physiological dead space is going to be created. So, please note down that it is not than less than anatomical dead space. So, this is also not correct. So, true answer is here, inadequate perfused alveoli, because alveolar dead space, whenever it will be positive, it will also add on to the physiological dead space only. Getting my point? So, B is going to be the correct answer here. A is not answer. Less than anatomical dead space, it is not. It is physiological dead space. Generally either it is more than anatomical dead space or it is equal to the anatomical dead space. It cannot be less than anatomical dead space, okay, and can be measured by spirometer. That is also not possible. So, only answer that is possible here, B. Okay. See the questions, what I am seeing here, the questions are simple. I mean, the topic, from the same topic they are asking question, but the options, some of the options they have given, that is a little difficult. So, you have to think a little bit. That is why it is INI-CET examination, you know. Even some of the questions I have to also checked, that I will show you one questions that whenever you look at the question first time, you will not be able to answer correctly, okay. Then you think and then you will be able to answer. So, questions are easy, but not that easy also. You have to give a little brain to that question, otherwise you will not be able to give correct answer. So, see here, it is very easy to miss and make a mistake here, that it is less than anatomical dead space. Physiological dead space cannot be less than anatomical dead space, because physiological is equal to anatomical plus alveolar. So, it has to be greater than or maybe equal, not lesser than. So, that is not correct. बाकी ये दोनों आप exclude कर ही लोगे, but the B is the correct answer here, because this is the alveolar dead space and that will add on to the physiological dead space, okay. So, this is done. Now, in which of the following conditions are peripheral chemoreceptor most sensitive to? Now, don't Google the answer here. What I told you here, that in my lecture classes also, the RR video also, I told you that if the question is primary stimulus for the peripheral chemoreceptor, then hypoxia is the answer, okay. It is the primary or it is the direct stimulus for the peripheral chemoreceptor. But if you look at the response of peripheral chemoreceptor to hypoxia and carbon dioxide, so if you decrease the carbon dioxide oxygen, so hypoxia is there, and if you increase the carbon dioxide, suppose you are changing 1% carbon dioxide concentration and 1% oxygen concentration, in which cases the peripheral chemoreceptor is going to give you more response. It is carbon dioxide, because if you recall the graphs of the carbon dioxide and ventilation response, then even 1% change of the carbon dioxide concentration can lead to huge increase in ventilation. And that is why whenever the question is most sensitive, I do not know whether the question has been asked about the most sensitive or not, because some of the students are saying that the stimulus for the peripheral chemoreceptor, this was the question. But if the question was the most sensitive, then it is not the hypoxia. Most sensitive means the answer will be hypercapnia, because it is clearly written in the book that hypoxia, if you produce more and more hypoxia from the 100 millimeter of mercury partial pressure of oxygen, if you decrease the partial pressure of oxygen, initially the peripheral chemoreceptor is not going to be stimulated. It will stimulated only and only when the partial pressure of oxygen is below 60 millimeter of mercury. That means it is not very sensitive to hypoxia, but even if you change the carbon dioxide percentage in your arterial blood a little bit, 1% also, then it will lead to huge increase in ventilation. That is why थोड़ा बहुत भी कार्बन डाइऑक्साइड ब्लड में बढ़ जाता है तो पेरिफेरल वेंटिलेशन इंक्रीज हो जाता है, वेंटिलेशन बहुत ज़्यादा इंक्रीज हो जाता है. सो प्लीज़ रिमेंबर दैट इफ इट इज़ मोस्ट सेंसिटिव टू देन हाइपरकैप्निया. हाइपरकैप्निया नहीं था, हाइपरकैप्निया नहीं था तो क्वेश्चन मोस्ट सेंसिटिव भी नहीं था. अदरवाइज मोस्ट सेंसिटिव एंड देन हाइपरकैप्निया नहीं दिया है तो ऑब्वियसली हाइपोक्सिया को मारना ही होगा, बट दैट विल नॉट बी आई मीन द बेस्ट ऑप्शन. बताओ बाकी लोग, एनीबॉडी, इफ यू कुड रिकॉल दैट क्वेश्चन वाज मोस्ट सेंसिटिव or hypercapnia was there or not. So I am putting a query here. Tha sir hypercapnia, yeah, it should be there. Hypercapnia given, yes 100%. Hypercapnia नहीं था इसीलिए तो प्रॉब्लम है. Hypercapnia नहीं था तो हाइपोक्सिया को मारना होगा, but that's not the correct answer, you know, because hypoxia is the primary stimulus, direct stimulus. पेरिफेरल केमोरिसेप्टर बना ही हुआ है हाइपोक्सिया को डिटेक्ट करने के लिए, बट सेंसिटिविटी का मतलब होता है कि इफ़ यू चेंज इक्वल परसेंटेज ऑफ ऑक्सीजन एंड कार्बन डाइऑक्साइड it will give more response, the neuron will fire more in which of this following, then the hypercapnia will be the correct answer. So if it was hypercapnia and if it was the question was most sensitive, then it is your answer. Okay, it is your answer. Okay, so this was the question, I believe. Even if you feel that some options was not correct, you can later on also I mean send in my email or my WhatsApp, whatever. Okay, market hypercapnia only, because very good, thank you so much. Okay, so in my RR video I told you clearly that peripheral chemoreceptor or central chemoreceptor, in both the cases most sensitive is the carbon dioxide, most sensitive is the carbon dioxide. But whenever the question is primary, here is the hypoxia, and whenever it is primary the answer is the H plus ion. Okay, direct or H plus ion is the central chemoreceptor. So this I have explained in my RR video. Got it? Okay, okay. Now next question. नेक्स्ट क्वेश्चन अगेन देखो, से क्वेश्चन इज़ वेरी सिंपल. ओके, बट आपको कन्फ्यूज़ करने के लिए थोड़ा बहुत एक्स्ट्रा चीज़ दे के रखा है. सो वेयर इट हैज़ बीन गिवन, सो दिस इज़ द नॉर्मल कर्व. ओके, दिस इज़ द नॉर्मल कर्व, राइट. So we know that whenever you store blood, packed RBC transfusion, so this is basically storage of blood. Okay, stored blood means which kind of shifts occur? We all know storage of blood means left shifts happen. Okay, so whenever you are infusing the packed blood, that blood is already stored in the blood bank. So whenever you do store blood, so that is a kind of left shift. And left shift means the OHDC curve, oxygen hemoglobin dissociation curve, will shift to the left side as it is, means it will not become a straight line. Normal shape of the curve is the sigmoid shaped curve. So the sigmoid shaped curve will be maintained, but the curve will be shifted to the left hand side. So if you look at here, only one is correct here. So this is the left hand side shift of this curve. So B is the correct answer. So A is the correct answer in this question. Okay, getting my point? I hope you recall this RR video. So whatever you, whoever has seen my RR video, so I have told you there the storage of the blood. Okay, that is the causes of left shifting. So this was the heading of this RR video slide. Left shifting cause, one of the important causes, storage of blood. Okay, packed cell. So storage of blood means the curve will be shifted to the left hand side directly. Okay, so this was the answer of the question. Next question, all of the following are seen in decompression signal except. Now look at here. Generally whenever we talked about the decompression sickness, what we taught you in classes, we taught you that there will be bends, okay, there will be chokes, and there will be CNS symptoms. That was the three predominant symptoms that we read in decompression sickness. But look at the options, so that's why it's an INI-CET question. So now you have to apply your knowledge. So what do you know about decompression sickness? The nitrogen bubble will be created, and nitrogen bubbles, okay, they can block the capillaries. So this coagulopathy can be seen in case of this decompression sickness, okay, because it can causes problem in the coagulation path. Okay, then second, the hearing loss, vision loss, all of them are the under the category of the CNS symptoms. Severe decompression sickness can leads to the hearing loss and vision loss also. So here you have to go by exclusion, that hemodilution is not going to happen in case of decompression sickness. Okay, but I believe this question is not direct. Okay, so you have to apply your common sense there in the exam hall and think of the decompression sickness. The CNS symptoms are there, but we generally, if you look at the books, even in the literature also, the hematological symptoms, signs, symptoms has been not given in case of decompression sickness. Okay, but by applying knowledge we can understand that this CNS symptoms is very common in case of decompression sickness, and coagulopathy because the nitrogen bubbles are going to block the capillaries, partly the small capillaries of the muscles and bones. So, this is also true, but A is by exclusion, you can give correct answer. Okay? Okay. So, the next question is from endocrinology. See, this time INI-CET has given many questions from physiology, anatomy, all these basic subjects, right. So, look at here, this is again the same things that I have shown you in my classes. So, if you look at my RR video lecture, there we have discussed that this tyrosine kinase receptor, okay, tyrosine kinase receptor, what are the hormone? The insulin, insulin like growth factor, EGF, NGF, all of them are tyrosine kinase receptor. And if you look at this JAK-STAT pathway, I told you clearly that this JAK-STAT pathway is very important. It has already been asked in the NEET PG exam also. So, the growth hormone is the JAK-STAT pathway. So, even if you coagulopathy, that is why I am saying now this is a blockage of the capillary. So, the capillary blockage that could be put under the coagulopathy category. Okay. So, this growth hormone, okay. So, match it. So, insulin, tyrosine kinase, ये तो easy match हो जाएगा. Growth hormone, JAK-STAT pathway, okay. Levothyroxine, we all know that's a nuclear receptor. So, levothyroxine is the nuclear receptor, intranuclear receptor, okay, and A-acetylcholine, that is the remaining. So, 1 is D. So, 1 is with D, 2 with C, 3 with B, and 4 with A. Okay. Okay. So, first one is given. So, this is your correct answer. Okay. So, this was easy, I believe. This was easy question, okay, because most of the cases I told you in my classes also repeatedly that for endocrinology, if you have to read only one thing from physiology, endocrinology of physiology, then it is the hormone receptor that you have to read carefully, and that is true here. The question is from the hormone receptor only from this slide the question has been given, okay. Now, next question. Now, this was the question what I was looking at, that adrenal medulla secrete catecholamines in response to all of the following except. So, except is your question. Now, again in this question if you Google, everything is the correct answer, there is no except according to Google. करके देखना, मैंने भी करके देखा, because I was particularly worried about this hyperglycemia. Otherwise, I was looking at all of the options. Okay. So, even if you Google, hyperglycemia is also a stimulus for the adrenal catecholamine secretion, but again book is book. So, if you look at Genong, so this is the table which is given in the Genong, that what is the stimulus for catecholamine secretion, and here you are finding out that exercise is a stimulus, cigarette smoking is a stimulus, standing is also a stimulus, although supine is also a stimulus, but standing is secreting more catecholamines. Okay. So, exercise, cigarette smoking, quiet standing, and hypoglycemia is a stimulus for catecholamine secretion. So, here it is clearly given hypoglycemia is the stimulus for catecholamine secretion, not this hyperglycemia. So, I believe the question has been taken from this Genong table, and hyperglycemia should be excluded in this question. So, this is your correct option, but I told you again that if you Googled, then B is also a stimulus for catecholamine secretion, but other options you can easily exclude. Standing up will stimulate the sympathetic system, smoking is definitely stimulate, during exercise catecholamines release is very common. Okay. So, all these three are true, B is the exception. Hyperglycemia is not a stimulus according to Genong, hypoglycemia is a stimulus for catecholamine secretion, right. So, this is all about the physiology questions that I have received from students and my team. So, I believe all of the questions has been discussed, and if you have any questions or queries, you can contact later me also through my Instagram profile, or you can directly message me in the PrepLadder platform if you are there. So, this is all for today. Thank you so much. Take care. Good night.